Well, meantime, more hospitals are shutting down with what some consider a vital part of overall patient care. We're talking about maternity wards. They're closing, and they provide care for pregnant women and newborn infants. Across the U.S., hospitals have been seeing a decline in births since the early 2000s. Hospitals closing units say they're having trouble recruiting staff because hospitals that record fewer births are less attractive to doctors and nurses. These closures are likely to have a huge impact on pregnant women. Maternal mortality rates are climbing in the U.S., and women and babies born in remote rural communities with no maternity wards are at higher risk of serious complications. So joining me now is Dr. Sujatha Reddy, an OB-GYN at Premier Care for Women in Atlanta. Dr. Reddy, thank you so much for your time. This seems so disturbing to hear this. So what are people in these rural communities supposed to do? Do they have to opt for more at-home births, more midwives? What is the solution?
Yeah, that may be part of the solution, but what we're really seeing is people are having to drive long distances to give birth, which is, can be very problematic and inconvenient. And for someone who's having their fourth or fifth baby, those labors tend to be very quick, and that can be a problem. But you're right, some people are turning to more home births, looking for accessory healthcare providers like doulas. Midwives are a good option, but this is a, kind of scary situation. But it's not just one factor, as you mentioned. It's the declining birth rate, it's the shortage of staff and physicians. And, we're seeing that there are more physicians migrating to urban areas than the rural areas. And as you mentioned, this doesn't bode well for what we're trying to do with our maternal mortality rate, because we have one of the highest, if not the highest, in the industrialized world.
And I want to talk about that a little bit more, Dr. Reddy, because you have to imagine that these closures will impact the maternal and infant mortality rate, which, I think a lot of people are surprised to know it is a lot higher in the U.S. than people may expect.
Yeah, and I think you're right. It could have that impact. And I think it is scary, especially, for patients who may have a high risk pregnancy. And things that can make you a high risk pregnancy are being over 35, having other medical conditions like obesity, high blood pressure, diabetes. These are all things that can necessitate extra care. And if you're having to drive an hour or two to the hospital, that could be very risky for mom and for baby.
And we know that there are reasons for this, Dr. Reddy, but are these closures maybe drastic decisions being made on something which could change in 5 to 10 years? Let's say there was a turnaround in the birth rate here in America.
Yes, you're right. It could turn around, but I think those are many years away, and it will require a lot of, research. And, the hospital has to have the budget to sustain reopening a unit. So I doubt that will be very easy, and probably not likely in these rural areas. And that is where we've already seen, even prior to seeing this uptick in closings, that's where we've seen, healthcare deserts as it is. So really, this impacts our rural communities much more than the urban ones for obvious reasons.
Well, my last question for you, Dr. Reddy. We have these falling birth rates. We have these high or higher than desired maternal mortality rates. What do you think is our health landscape in let's say, 10, 20, even 30 years?
That's a really tough question to answer. I really do believe we have a wonderful medical system. I'm proud to be a part of it in the U.S., but we do need to fix some of the issues that are plaguing us. And that, is so many things, so multifactorial. But I think we will have to look at some of these and perhaps make some difficult decisions, more funding, more staff, more physicians. There's so many variables that need to be addressed. But I still think the healthcare system in the U.S., I'm proud to be part of it.
Well, we do like to end on a positive note. Like to hear that. Dr. Sujatha Reddy, thank you so much for your time. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.